PrEP for All is the name because it benefits when everyone has access. And that doesn't mean just everyone who's American. It matters that we are helping to provide life-saving medication to entire communities, first and foremost because they are people, but second of all because we live in a global community and what happens abroad affects us here as well.
Normally be 6 or 7 men that had the lesions, that had the marks. So when somebody failed in that line, fell in that line, they were taken care of so that we could get them down to the shower, give them the towel, razor, and soap, and have them have the best part of their day. So I stayed in touch with that vision that I had, and that desire, that eagerness, and that curiosity to want to know more and try to help more has ever been present.
So I am very alarmed by the way our culture, our society, our government is approaching HIV and AIDS prevention. We should all be committed to this.
If federal funding's cut, it's gonna be a burden on people if they don't have the right access or the things they need to live. And it's gonna affect New Yorkers in that
we can have great legislation, but without human connection and talking to each other, it's hard to convince some folks to get on board.
So for me, it's a question of what kind of public leadership do we want to support and get behind? Do we want to move towards working in the upstream, and that is supporting science, supporting research, and
what we have right now in New York City, around the country and around the world, but particularly here in New York, is a health equity crisis. We know that new HIV diagnosis is really among our black and brown New Yorkers, who are 50% of the city's population. And most of those people who report new infections also don't have health insurance. Unmet need is absolutely staggering, the number of people that could benefit from PrEP and don't. 1 in 4 have access. That is ridiculous. And as you mentioned,